All right, we'll go ahead and get started. Thank you all for being here for our monkeypox town hall for Washoe County. I want to thank everyone for joining us. I know it's some short notice, but we thought it had to be done right away given the urgency of the matter. As we reported today, there were 2 additional monkeypox cases in Washoe County, both males, one in their 30s, one in their 40s, and neither were hospitalized. So the purpose of this today is really to give a kind of a brief presentation from a few of our subject matter experts at the Washoe County Health District and Northern Nevada Hopes, and also just open it up for questions. That's what we're going to spend most of the time doing it, so these subject matter experts can answer. Those on the panel today are Nancy Dow, Division Director of Epidemiology and Public Health Preparedness for the Washoe County Health District, Lisa Lotritz, who's the Division Director of Community and Clinical Health Services for the Health District, Michelle Wagner, who's the Director of Clinical Services for Northern Nevada Hopes. She's also a nurse practitioner as well, and Jennifer Howell, who is our Sexual Health Program Coordinator at the Health District. As we stated in a press release yesterday, we have a revamped web page that has a lot more information regarding monkeypox in Washoe County. Feel free to go to that at any time. It's washoecounty.gov/monkeypox. I'll be posting that in the chat here pretty soon. We also have an email, monkeypox@washoecounty.gov. If you have any questions there, you can send it to that email. We also are recording this, so we will post this on our YouTube channel and send that out on our social channels and post it on our website as well. Sorry about that, Michelle. I incorrectly identified you as a nurse practitioner. She is a registered nurse. My apologies for that. Also, if you have any questions in Spanish, we have an interpreter on this town hall. I'd like to pass it to Yera Diavola, who's a media and communication specialist here at the Health District.
Thank you, Scott. So just a message for Spanish speakers. Un mensaje para nuestra audiencia que habla español. Si hay personas quienes hablen español y tengan alguna pregunta, pueden hacerla escribiéndola en la área para chatear y con gusto le interpretaré la pregunta y la respuesta de nuestros panelistas expertos. Gracias. With that, I'll pass it on to you, Scott.
Thank you very much, Yera, for that. Okay, we'll get right to it. I'll introduce our first speaker is Nancy Dow, again, Division Director of Epidemiology and Public Health Preparedness at the Health District. Nancy, if you're ready, please unmute and go ahead.
Thank you, Scott. As Scott mentioned, we now have a total of 3 probable cases of monkeypox in Washoe County. Contact to the 2 new cases are being reached out to, and those assessed as eligible for post-exposure prophylaxis are being arranged for the Jynneos vaccine. The current outbreak globally and nationally is of concern because we're seeing a large number of outbreaks taking place in multiple non-endemic countries around the world. This scale has never been observed in the past, and our global and national cases continue to climb, and we do expect to see that increase as well in Washoe County as we continue surveillance efforts. The White House yesterday declared a public health emergency of monkeypox. We too are taking this outbreak very seriously. While most cases seen in the current outbreak at this time is in gay, bisexual, and other men who have sex with men, anyone can get monkeypox if engaged in close physical contact. The association seen in the at-risk population and spread through sexual social networks at this time is consistent with transmission between close contacts, not necessarily or only sexual transmission. More data are getting gathered and analyzed to help us learn more about this global outbreak. Knowing the current disease spread, awareness of mode of transmission and symptoms, and with that, doing temporary behavioral modification and seeking assessment right away when needed is very important. I do want to note that not every case will look exactly textbook. In the current outbreak, many cases are seeing relatively few lesions. Rash may only be at specific areas of the body and not always disseminated. The typical prodromal symptoms may be mild or absent, or even sometimes seen starting after the rash has already started. Because of rash location and presentation of some cases, especially in the beginning of this outbreak, It's easy to confuse monkeypox with some other STIs. A broad diagnostic approach and being alert for clinical presentation and epidemiological criteria is very much needed. Co-infection with STIs are possible, so a diagnosis of one is not a rule out of the other. The good news here is that globally, still relatively few deaths have been occurring in this current outbreak in non-endemic countries. Vaccines are available, treatment under EAIND can be accessed, but I can't stress enough that behavioral modification and the correct awareness is very important. And with that, I will pass this to Lisa Lotris to discuss monkeypox vaccines.
Thank you, Nancy, and to everyone for being here. Our vaccine inventory remains extremely low. And as we stated yesterday in the press release, we have enough vaccine for about 150 people. And due to this limited supply, we are keeping that to the recommendation of just confirmed contacts to confirm cases and personnel that are handling the specimens. Our shipments they come straight from the state and federal agencies. Those we do not get to choose our allocations, so we get what is allocated to us. This is out of our control. We agree that this is not enough for our community and are hoping to get more as more allocations are available. Because there are so few, we have to keep that to the contacts of the confirmed cases and the healthcare personnel that are handling the specimens. We completely understand that this is not what people want to hear, and that other areas of the state and the country are doing things a little differently, and that just is based on their allocations, and we can only do with what we have here in Washoe County. We are preparing for if our allocation increases, for eligibility to change. And we're prepared to vaccinate larger amounts of people as we did it with COVID. And we were very successful with that and ready to do it with monkeypox if need be, once the allocation increases. So we're just waiting for that, just like everyone else is. But at this time, we do not have enough vaccine to make these changes. So that's all I have for that. I will pass it on to Michelle Wagner from Northern Nevada Hopes. Thank you.
Hi, I'm Michelle Wagner. I'm clinical director at Northern Nevada Hopes, and we have currently been getting updated as far as what we need to do as community health providers to make sure that any cases that we do see are handled appropriately to keep everyone safe. We learned a lot with COVID, and we wanted to be sure that we took those lessons and continued them on to deal with this situation that could potentially become pandemic. We don't know, but we do want to make sure that everyone stays safe. The first step was making sure that we had all requirements in place. As everyone knows, when we have something new, we have to learn how to test for it, what kind of testing mediums we need, what kind of forms are required. And there was some specialized forms that were required for informed consent that came directly from the CDC. Tecovirimat is what is used to treat monkeypox. So when that is used, it can cause some issues. It does have some side effects. So we do have to be sure that if we do plan on treating a patient with Tecovirimat, we have the correct signage, and that patients do know that there are some issues that could be presented with it. As of right now, we have the Tecovirimat in our possession, and we are starting to take phone calls, and we will start making appointments next week to see patients that are concerned that they have some signs and symptoms of monkeypox. So we will be seeing them in the same fashion that we see patients that call in for our COVID appointments, in which we have modulars and physicians outside. So it's actually, it's well set up. We did learn a lot from COVID. So we're following that model in order to see patients that are being seen for any possible monkeypox outbreak. We are also doing the paperwork and getting approval to be a site for vaccines once more doses are released to the public. So we would like to, we are going to partner up with the county. So as more vaccine doses are rolled out, we will be able to assist the county in giving patients the vaccine. As of right now, though, we do not have any, but we are currently in the works to get that done. So if Hopes is here, if you are a patient, if you do have any signs, symptoms, or concerns, please feel free to give us a call. Every phone call that is a potential monkeypox outbreak, or anybody that has concerns about any symptoms that they have, all of those calls get triaged to a nurse. So you will be talking to a nurse that will talk to you about your signs, your symptoms, and what your next step should be. So we are in the process of making sure that anybody that is concerned about any monkeypox outbreak or signs or symptoms, that we can handle those phone calls. I will send it over now to Scott.
Okay, thank you very much, Michelle. Just a couple administrative things. We are posting this webinar on Facebook. So if anybody's having trouble accessing that, if you go to our Facebook page, Washoe County Health District, you can watch it on there. I'm also going to post in the chat the passcode. I'm hearing some people saying that they're being required a passcode, which wasn't supposed to be the case, but I will put that in there as well. Really today's a great time just to get any questions answered by our great panel. We have a couple questions rolling in on the Q&A function on Zoom. There's a way to ask questions through there. So we have a couple other questions that we've been getting quite frequently. So if we get to a point where we don't have enough questions through the Q&A function, we can get to those. But the first question we have is what were the first symptoms noticed of the 3 patients within Washoe County? Nancy, do you want to take that one?
Yes, so for all 3 of our cases, rash was present. As I said here, where awareness is key, and the case of monkeypox is not always going to be a textbook version, is because in some of our cases, the prodromal symptom of flu-like symptoms were seen after the rash has started.
Okay, thank you. And then another question regarding vaccines is, what is the method that vaccine allocation is determined? Lisa, you want to take that one?
Yes, sorry, I can take that one. That's a great question. The method is based on the HIV positivity rate in our community in Washoe County. And so just for reference, ours is about, well, Southern Nevada's is about 10 times what ours is. So when we see that they're getting a large amount of doses, that is the reason, because their positivity rate is a lot higher than ours.
Okay, thank you very much. We're starting to get some more questions. So thank you to everyone who is putting a question in the Q&A function. This is actually a question from the RGJ. Might be for Nancy. It says, did the 2 most recent monkeypox cases travel recently? Also, did the 2 cases have any contact with each other?
Yes, we did see travel in one of the cases, but there is no contact of the cases with each other.
Okay, thank you for that. Next question is, are the people that received smallpox vaccine in the past protected from monkeypox?
can take that, Scott, if you want me to.
Yes, please.
So the smallpox vaccine only protects you for about 6 years. So if they received that many years ago, no, it would not provide the protection.
Okay, the next question is, do you anticipate establishing a public health emergency with the intent to administer the 2 different types of vaccine? And will you ensure informed consent when administering these vaccines? So unfortunately, our district health officer, Kevin Dick, is not in the office today. But Lisa or Nancy, is there anything that can help kind of at least partially answer any of that question? And then if not, we can reach back out to the person that asked to get them that information.
I guess I can answer the part about informed consent. Most definitely, we are not going to provide a vaccine to someone unless they provide consent for the vaccine. So that is a yes for that portion. And as far as the types of vaccines, I think that was another part of it. We only have the Jynneos right now, and I don't know that we'd be getting the other vaccine. So the allocations, that's the only one that we've been provided. So I can't say if we'd have the other vaccine or not.
Okay, thank you, Lisa. Next question from the Q&A is, what are the recommendations for Washoe County schools that start in a week? I don't know if Jennifer or Nancy have an answer for that.
I can start on this. We are seeing relatively very low number of cases in children happening in the US right now. But of note is that children younger than 8 especially can, if they do contact the disease, can have a higher risk of having more severe symptoms. So that's why awareness to the general public is important, so that if you are a child and you do contact the disease, and you need to be aware and seek medication and medical providers right away.
Jennifer, did you have anything to add to that, or was that sufficient? Or sorry, Michelle or Jennifer, either one, sorry.
And I'm going to actually thank you, Scott, for bringing me into this conversation. Just like anything else, wash your hands, try to social distance. It is hard. Kids get back to school, they want to hug their friends and they want to spend time with them. Fortunately, monkeypox at this point appears to be less contagious than COVID. You have to have sustained contact, skin to skin, car rides, that kind of thing is what we're seeing as of right now. But just washing hands, trying not to share towels. It can be transmitted through dirty towels, and just doing everything you can to keep yourself safe on the same level that we've been doing to keep ourselves safe from COVID.
Great, thank you, Michelle, for that. Next question is actually a couple questions. Is asking, is the HIV rate in Southern Nevada 10 times what our rate is in Washoe? Question. And then based on population, does this establish how much vaccine we get?
So I'll take this. I'm Jen Health, Sexual Health Program Coordinator. And just for the rate per 100,000, Clark County has 457.5 cases per 100,000 of people living with HIV in their county, compared to Washoe County's rate of 240.7 per 100,000. And that's just for the prevalence or people living with HIV. I'm not sure exactly if they're looking at incidents or our number of new cases, but we do average about 40 new cases a year for HIV versus Clark County that averages well over 300 cases a year. So there's quite a difference there. They hold over 85% of new infections annually and of new HIV cases, and we hold about 15%. 10 to 15% depending, and with the rurals having the remainder. So they're definitely a larger HIV prevalence in Clark County versus Washoe County. And since they're using HIV rates as the algorithm of how much vaccine gets allocated in a community, that does put us at a lower allocation.
Okay, thank you very much, Jennifer. The next question is from the RGJ. It says, is the health district or Northern Nevada Hope seeing panic among Washoe County's LGBTQ community?
I can take that, Scott. I wouldn't say there's panic. I would say that there's a lot of concern. There's concern that that the LGBT community, or actually more specifically gay, bisexual, and other men who have sex with men, are being targeted as in the messaging for this. While epidemiologically most cases are occurring in those groups, there is a potential for monkeypox to spread to other people in other sexual contact or just skin to skin contact. So while there is definitely a concern in the community that we've been hearing, we have to balance the message with who has been more represented in our epidemiology and nationwide and in the world, and then also locally, and then also that will likely spread to other members of the community.
Michelle, from a Hope's perspective, do you want to provide comment on the question about just what was it, panic among Washoe County's LGBTQ community?
Absolutely. Actually, that is one message that I have been trying to put across because with the HIV epidemic, AIDS epidemic, we unfortunately did see a lot of communities blamed and marginalized. And our message here at Hope's is that anyone can get monkeypox. It is not something that is merely relegated to the LGBTQI community. And as of right now, yes, more men having sex with men are being diagnosed, but it is something that can potentially affect everyone. So my biggest fear, it's not fear, it's a concern, is that some people may exhibit signs and symptoms of monkeypox. And because that could be considered, oh, I couldn't have had that. I'm straight, I'm cisgender. Unfortunately, I really don't want the message to be that this is something that strictly affects the LGBTQI community and can affect everyone. So everyone that does have signs and symptoms can get treated and can get tested. That being said, we have received some phone calls. Fortunately, we haven't seen anything or heard of anything that really gave us concern yet. Again, this is all through our line that goes through our triage with our nurses. The phone calls we have received have not given us pause that, oh, this is definitely a monkeypox case, but anything that does sound concerning at this point, because we weren't quite ready to see them, and we will be next week, we have been sending them to Renown for testing and, if necessary, treatment. But as of right now, there isn't a panic, which is good. I'm hoping that the more information that we put out there, the more educating we do, it will minimize the panic.
Thank you for that response, Michelle. Our next question is, are symptoms for monkeypox in children different from adults?
So symptoms in children, we are always going to see the typical rash that's being seen, but children, given that young children especially tend to have more severe symptoms than adults if they do get infected by this disease. So it's expected that they would be seeing more severity. We have relatively limited children in the current outbreak to analyze right now as we learn more.
Okay, thank you, Nancy. Next question is, I understand the danger of prolonged skin-to-skin contact, What is the danger in the homeless population who may be using hypodermic needles and have unintentional transmission through drug-induced carelessness? Is there, I don't know, Michelle or?
I can absolutely answer that.
Okay.
Fortunately, here at Hopes, we do have our harm reduction center. We do have the needle exchange program that is very well used. So there is some thought given to, at least amongst the patients that do use drugs and use needles. So we do have that needle exchange program, which is robust, and we do protect a lot of people in the community with that. Fortunately, with the homeless population, they're already very aware of the dangers they face simply because they are unhoused. So because of the fact that they're aware, and they have been aware since COVID has started, that they do have to maintain some safety and some distance. So essentially speaking, the homeless population in our county is wise to the risks that they see and that they face. And they have actually learned how to live with those risks because of their living situation.
Thank you, Michelle, for that answer. The next question is, what does the rash look like? I think either Nancy or Michelle can answer that. I'll also post a link to the CDC, which has some images as well.
So the typical presentation of the rash is that it's firm, deep-seated, with a clear border, well circumscribed, and usually have an amplification of some stages. But the rash itself can present through multiple stages as it progresses. So some of the earliest stages in macules and papules stage, it might be easily confused with other rashes you might see in other infectious diseases. So we do want people to be aware of epidemiological criteria as well, whether you had exposure recently, and to not just let those earlier rashes be misdiagnosed as something else.
Okay, thank you, Nancy. One question we received via email yesterday, I think it's for Lisa and Michelle. When are we going to get more access to the vaccine in Reno?
That I don't have an answer for. We expect to have additional, we are calling it a wave, additional wave of vaccine sometime this month, but we don't have any particular date, and we don't know what the allocation is. Sorry.
And I don't have, that's the information I have as well.
Okay, thank you both. The next question is, why have there been more cases identified with men who have sex with other men? And what are some of the recommendations you would give to help men who have sex with other men to protect themselves? I'm not sure who wants to take that one. I'll open it up.
I can take a stab at it first. The monkeypox virus, just like the HIV virus, was just introduced into the men who have sex or gay, bisexual, and other men who have sex with men community in social networks. And so the cases have been occurring in those social networks because of close skin-to-skin contact. It may not even just be sexual, but skin-to-skin contact, and it could be, you know, at social events and that kind of thing. So recommendations would be to limit partners. Condoms are always protective to where protecting the area that they are covering. And then maybe consider some virtual, if for sexual contact, maybe considering virtual or having some distance with your partner. I know that sounds odd, but the CDC has some guidelines available, and we have a link to those. So I would just say limiting partners, keeping within a close social circle, and in knowing that it's not just sexual contact, but it also can be close skin to skin contact. Anyone else?
Absolutely. I would like to take that as well. So when we have seen I'm trying to figure out how to put this. So essentially what past outbreaks have taught us is that men that have sex with men are very, very proactive. And so they know when it comes to their sexual health, they have to be very on top of it. So they're the ones that do get treated, tested first, based on the fact that they are very aware of their sexual health. So I believe that's one of the reasons that we are seeing it more prevalent in that community. And again, it was the point I made earlier in which that there may be some hesitance amongst people that are, again, defined as heterosexual in getting treatment because they feel that at this point it's strictly a disease that affects men having sex with men, and they don't want to admit that they may have monkeypox because, again, that will put them in a group that they don't want to belong to. So that's unfortunate. But I feel that that's why we are seeing these cases this way first. And that's part of the reason is my belief.
Okay, thank you both for those answers. Next question is, can monkeypox be contagious before symptoms appear?
So that's a very good question. That's definitely being studied right now as more cases come in and more of the current cases are being analyzed. But as what we know of now is that you're contagious once your symptom starts, and the symptom could include anything from your prodromal symptoms such as your fever, malaise, your swollen lymph nodes, just general unwell, and you're contagious until all the way of your rash has scabbed over, the scab has fallen off, and new skin has formed.
Thank you, Nancy. We got a question also that I think you may or may not be able to answer. It is, do we know how the two people infected got the virus, and did they get it the same way?
So exact transmission of how they got the virus, I don't want to comment into too much details, and that's something definitely we're still looking into right now.
Okay, thank you. So getting a couple questions. We got one on Facebook and on Zoom about this, but I'll read the Zoom one. Can monkeypox be transmitted on hard surfaces? And if so, how long?
Well, fomi transmission of monkeypox definitely is possible in terms of how long the virus lasts on surfaces or even on utensils, beddings and things like that. That's being studied, and we're waiting for that result to come out.
Okay, thank you. And a follow-up to that is, are monkeypox infections occurring anywhere on the body or just mucous membranes?
I can
Nancy
take
or
that.
Michelle. Okay. Yeah, go ahead.
Michelle, go ahead.
So in the reading I have done, it appears that most of the time it will appear on mostly the arms. It will appear in mucous membranes. It will appear on the face. Sometimes I believe 30% it's genitalia, but 70% is mucous membrane. So you will see it in intravaginally and intraanally. So mostly face, arms, and mucous membranes.
Okay, thank you for that answer and the question. Next one is, what are the isolation quarantine periods for monkeypox?
As soon as you develop symptoms, you should be in isolation. And this will last all the way until your full course of your disease, meaning your rash has scabbed over, the scab has fallen off by itself, and new skin has formed.
And just a reminder, the Q&A function for this Zoom is the best way to get some questions in. We also are streaming this live on our Washoe County Health District Facebook page via Facebook Live. Next question here is there a way for the general public to test for monkeypox on surfaces in their homes or businesses? It appears we might have to get back to you on that one. I believe I have your contact information for the person that asked that, so I will work on gathering a response for that. I'll allow a little bit more time just in case anybody has any kind of last second questions. Oh, we got it. Here we go. Is the Washoe County contact tracing currently underway, indicating any nexus to social gatherings conducted in the last 2 weeks? Nancy, I don't know if we can speak too much about that.
Oh, we're every case that comes in, we conduct case investigation and we identify contacts related to this case, whether the contacts are in our jurisdiction or not. And then if the contacts are not in our jurisdiction, we do notify the jurisdiction that they are in. And if they are in our Washoe County area, then we are reaching out to contacted individual basis to notify them as well as to arrange for their post-exposure prophylaxis when needed.
Okay, the next question is, do hard surface cleansers typically used for COVID as effective cleansers, do those work on monkeypox?
Yes, so cleaning supplies, you do have to, first of all, follow the instructions. If it says clean the surface with the dusting off first, then do that. But cleaning supplies used for COVID are generally effective for monkeypox surface cleaning as well. This is an envelope virus, meaning the good news is that for most cleaning products, it will be able to eliminate hard surfaces.
Okay, another question here. What is the duration of time you would have to be around a confirmed case to be considered a close contact? Nancy or Michelle, any thoughts on that?
I actually did ask someone this very question last week. I had a meeting with members of the CDC, and the answer that was given to me is prolonged. So not including skin-to-skin contact, because again, skin-to-skin contact, there's really no way to tell how long that would have to take place. But in a room with someone, what I was told to say, think of a 3-hour car ride where you're in a small amount of space for a longer period of time. So I like the car ride for 3 hours type of rule. But again, if things are just right, if you're with someone in a situation and you're only together for about 20 minutes And if the conditions are great, then you can also get it as well. I think the biggest part of this response is that it's not casual contact. You can't just walk next to somebody and catch monkeypox. You can't just be sitting with someone and catch monkeypox for a short period of time. It does have to be prolonged casual contact or skin-to-skin contact.
Add to that, Michelle, very correct on that. If you're going to a grocery store and you're next to someone, you're not going to catch the disease. Skin-to-skin contact is the most efficient way of getting monkeypox, for lack of a better word, but you get it through close respiratory secretion from face-to-face interactions, can be through touching contaminated items of clothing, bedding, towels, sharing utensils used by an infected person.
Okay, thank you for that. Next question. This might be for Lisa or Michelle. Since hairstylists are one of the few industries licensed for skin-to-skin contact on a regular basis, is it possible that industry will be included on the vaccine for frontline workers?
We have not been given any information on that, so I don't want to give an answer that I don't know the answer to that.
Okay, thank you. And then next question is, are there any statistics related to the contacts of monkeypox cases? So I'm guessing statistics as in like common themes potentially for people that are contacts to a monkeypox case. Anybody have any information on that?
I'm not exactly sure what the statistic is meant. Is it age or other characteristics? And of course, those we wouldn't be giving out to protect the contacts. But at least for the close contacts that we are arranging for post-exposure prophylaxis with our Jynneos vaccines, these are people who did have very close contacts with the case, either through sharing materials, utensils, or prolonged sexual contact or household contact that has very intimate interactions.
Okay, thank you. One question we kind of touched on, but it was on the Facebook page. So I'll just say it again if one of our panelists can answer. Do we have any recommendations for back to school or school-aged children in terms of monkeypox and prevention? Looks like you're muted there, Nancy.
Oh, sorry about that. I think one of the important things, not just for people in the public, such as children, but also for cases themselves. If you do know that you are presenting with a rash that's possibly monkeypox, then seek treatment, or rather seek assessment with your provider right away and seek treatment if necessary when you're assessed. But when you are a case, you really should be in isolation and staying away from the public so you don't pass this on to anyone else. And for the general public, if you're in close interactions with anyone with a new rash that you don't recognize that could possibly be presenting similar to monkeypox, then you should really stay away and not engage in any close contact. I'm saying this as general public because it's not just children, this is for everyone.
And piggybacking on that, Nancy, I think it's also a good time to remind our kids, wash your hands, wash your hands, wash your hands, wash your hands. It's something that we were really great about at the beginning of COVID. And now we've gotten a little bit complacent again, which happens, but it's a good lesson to keep stressing to kids that are going back to school. Practice good respiratory hygiene, which means if you're going to sneeze, sneeze into the crook of your elbow in your shirt, or pull your shirt over your nose and sneeze in your shirt. Make sure, again, try to keep as much social distancing as possible. So it's a good lesson to keep stressing to everyone, but especially now that kids are going back to school, remind them to practice hand washing and respiratory hygiene.
Okay, thank you for that. We have no further questions, so I'll pause about 30 seconds just to make sure there isn't any other questions that anyone in the community has. We've had great participation so far, so I want to thank everybody. Really good questions. While I wait just to see if there's any last minute questions, just want to remind everyone that we are up to 3 cases in Washoe County. We had 2 additional today. Any information you're looking for in terms of monkeypox in Washoe County can be found at washoecounty.gov/monkeypox. And if you have questions after the fact, feel free to email monkeypox@washoecounty.gov. We did get one. Oh yeah, wow, look at this. Okay, we got a couple more questions. This relates to monkeypox and pets. So the question is, can it be transmitted from humans to dogs and cats? Can dogs and cats transmit it to humans? I don't know if Nancy or Michelle has any information on that, or if that's something we need to get back to this person on.
Sorry, having technical difficulties. But yes, it is possible for transmission between humans and pets. So for abundance of caution, that should be put on awareness as well. And one of the things that we did see in a previous outbreak in 2003, that was through pet prairie dogs that had contact with endemic animals from endemic countries, and that passed this virus to humans.
Okay, thank you very much. The next question is monkeypox transmission through healthy intact skin or through mucous membranes? Nancy or Michelle, if you'd be able to answer that?
From what I understand, and it can be spread through intact skin. That being said, because when the pustules are in the state in which they are secreting pus, and you can leave it on someone else's skin, even though our skin appears intact, there are micropores. So even though our skin is a great first line of defense, there are still sometimes breaks, and it is a portal of entry. So just to be cautious, in the abundance of caution, if you see someone with anything that could be questionably monkeypox, just make sure that you have that person sequester and isolate and get assessed by a physician. It is definitely easier to catch mucous membrane to mucous membrane because those are very porous portals of exit, portals of entry. But the skin definitely is still, even an intact skin can still catch monkeypox virus.
Okay, thank you very much. The next question is monkeypox like poison ivy that can be spread around our body by touching our own skin? Like, I think, and whoever asked it, if they want to clarify, but if I'm wrong, I believe it's like, if I had it on one arm, could I spread it to the other arm by touching my arm with the other arm?
That part is being studied, but auto inoculation, for example, if you do have it on your fingers and you touch maybe your eye, that part of auto inoculation can happen.
Okay, thank you. And then another question going back to the pets are the symptoms for monkeypox the same in pets as in humans? Or do we know that yet?
For symptoms in pets, you'll probably notice that your pet just looks very tired, your pet might be coughing, just overall, maybe your pet has a lack of appetite, and then you might see small rashes happening on your pet, and that could develop into more characteristic rash.
Okay, and then a clarifying point about a previous question we asked. So the follow-up is there any information regarding how many people have been in close contact with people diagnosed with monkeypox in Washoe County? I'm guessing.
At the moment, I think that's the information we prefer not to disclose at this time. But the contacts are all array of contacts being assessed, whether it's mild, intermediate, or high-risk contacts are being identified.
Okay, I'm not seeing any other questions. I am seeing some comments from people in the community thanking us. I'd like to thank our panelists for taking the time during a very busy day to help inform some of the people in our community and just being available. I want to thank everybody who's been on this call, asked questions. We really appreciate it. Again, we want to keep the conversation going. So if you have any questions, feel free to email us and just keep an eye on kind of some of the information we have on our website. So with that, we'll go ahead and end this webinar. Again, it has been recorded, so it will be posted on our washoecounty.gov/monkeypox webpage. We'll also put it out on social media. If media need the file for this, please reach out to me via email and we'll get that to you. Otherwise, thanks again to everyone for participating and have a great day.